Have you ever had that strange sensation? That odd feeling of pins and needles, or maybe a mild numbness, perhaps in your hands, feet, or even your face? It's often described as a limb falling asleep. While sometimes it truly is just a tricky sleeping position, for many this feeling can pop up when they're not even physically constrained. What if this sensation, this tingling, isn't just a random occurrence, but a subtle signal from your body tied to something deeper? What if it's your anxiety manifesting in a very physical, undeniable way? Welcome. Today we're going to unravel the mystery of anxiety tingling, medically known as paresthesia. We'll explore why it happens, what it means for your body, and most importantly, what you can do to find relief. This isn't just some abstract concept, it's a very real and common physical manifestation of anxiety, and understanding it is the first step towards managing it. The experience of anxiety tingling can vary widely. For some, it's a fleeting prickle. For others, a persistent numbness or a mild burning sensation. It can feel like an electrical current or simply a dull lack of feeling. While it might sound alarming, it's a direct result of our body's finely tuned physiological responses to stress. And you're not alone in experiencing it. This topic is gaining significant attention because so many people are looking for answers, often misinterpreting these sensations as signs of something far more dire. So let's dive into the core question. Why does anxiety cause this tingling? Our bodies are incredible, equipped with an ancient survival mechanism known as the fight or flight response. When we perceive a threat, real or imagined, this system kicks into high gear. First, stress hormones like adrenaline and cortisol flood your system. These hormones are designed to prepare you to either confront the danger or run from it. One of their key actions is to divert blood flow. Imagine your body as a highly efficient machine. In an emergency, it prioritizes vital organs, your heart, lungs, and major muscles for immediate action. This means blood flow is temporarily reduced to less critical areas, like your extremities, your hands, feet, and even your face. When nerve endings in these areas receive less blood, they can start to send abnormal signals, leading to that distinct tingling or numbness. Another significant player is hyperventilation. During anxiety, many of us unconsciously start breathing more rapidly and shallowly. This isn't efficient breathing. It means we're taking in too much oxygen and expelling too much carbon dioxide. While it might sound harmless, this imbalance decreases the carbon dioxide in your blood, making it more alkaline, a condition called respiratory alkalosis. This shift causes blood vessels to constrict, particularly those supplying the brain and nerve endings. Again, reduced blood flow and altered nerve function manifest as tingling, often accompanied by dizziness or lightheadedness. And it doesn't stop there. Chronic muscle tension, a hallmark of anxiety, also plays a role. When you're constantly tense, perhaps clenching your jaw, hunching your shoulders, or tightening muscles in your neck, this prolonged tension can actually compress nerves. Just like when you sit on your leg for too long, pressing on a nerve, chronic muscle tension can lead to areas of numbness or tingling. Elevated stress hormones can also directly affect nerve fibers, potentially altering how they transmit signals. These aren't imagined sensations. They are very real, physiological responses to the stress chemicals coursing through your system. They most commonly show up in your hands, fingers, feet, toes, arms, legs, and face. Think cheeks, jawline, around your eyes, nose, mouth, tongue, and lips. Sometimes people report it in their chest, scalp, or neck.
Now, anxiety rarely travels alone. This tingling sensation is often accompanied by a host of other physical symptoms. You might also notice a rapid heartbeat, shortness of breath, sweating, dizziness, a general feeling of panic or dread, persistent muscle tension, headaches, an upset stomach, or difficulty sleeping. Many also report weakness, fatigue, shaking, trembling, chest pain, chills, or a dry mouth. It's a full body experience, making it understandably frightening. So, how long does this tingling last? Typically, anxiety-induced numbness and tingling are temporary, resolving within minutes to a few hours as the anxiety episode subsides. However, for those grappling with chronic anxiety, these sensations can occur more frequently, or even persist for longer periods, becoming a constant companion. Here's where a significant challenge arises: the misinterpretation of these symptoms. It is incredibly common for individuals to mistakenly believe that anxiety tingling or other physical anxiety symptoms are signs of a more severe medical condition, a heart attack, a stroke, or a neurological disorder. This often leads to a distressing feedback loop. The fear of a serious illness intensifies the anxiety, which in turn exacerbates the physical symptoms, fueling more fear. The internet, while a powerful tool, can unfortunately amplify health anxiety if not navigated carefully. Another persistent myth we need to debunk is the idea that these physical symptoms are all in your head. This dismissive attitude is incredibly invalidating. As we've discussed, these are legitimate physiological responses, your body's alarm system misfiring. It's crucial to acknowledge that these sensations are real and deserve attention and understanding. This brings us to a crucial point, differentiating anxiety tingling from other medical conditions. While it's vital to understand anxiety's role, it's always advised to consult a healthcare professional. Think of it like this. If your car is making a strange noise, you don't just assume it's one thing. You take it to a mechanic to get a proper diagnosis. Similarly, tingling can be a symptom of other underlying physical issues, such as vitamin deficiencies, actual nerve damage, like from sustained pressure, circulation problems, diabetes, or neurological disorders like multiple sclerosis. Relying solely on an anxiety diagnosis without proper investigation could delay treatment for a different, potentially serious medical issue. Your doctor can help rule out these other causes, providing peace of mind and guiding you toward the correct path. So, what can you actually do when anxiety tingling strikes? The good news is there are both immediate relief techniques and long-term management strategies. For immediate relief, try these. Deep, slow breathing. This is your most powerful tool against hyperventilation. Breathe in slowly through your nose for 4 counts, hold for 7, and exhale slowly through your mouth for 8. This helps regulate carbon dioxide levels and calms your nervous system. Mindfulness and meditation. Focus on your breath or the sensations around you, gently bringing yourself back to the present moment. Progressive muscle relaxation. Tense and then relax different muscle groups in your body. This helps release built-up tension. Physical activity. Moving your limbs, light jogging, walking, stretching, or even gentle yoga can improve circulation and reduce nerve compression. Distraction and grounding. Engage your senses. Try the 5-4-3-2-1 technique. Acknowledge 5 things you can see, 4 things you can hear, 3 things you can feel, 2 things you can smell, and 1 thing you can taste. This pulls your focus away from the anxiety and into your immediate environment. For sustained relief, it's essential to address the root cause of your anxiety. This often requires professional intervention. Cognitive behavioral therapy, CBT. This therapy helps you identify and change negative thought patterns and behaviors contributing to anxiety.
Somatic therapy. This approach focuses on the body's sensations to release trauma and tension. Trauma-focused therapy. If your anxiety stems from past trauma, specialized therapies can be highly effective. Medication. In some cases, your doctor may suggest medications to help manage anxiety symptoms, often in conjunction with therapy. Beyond professional help, lifestyle modifications are vital. Regular exercise, a balanced and nutritious diet, adequate sleep, and minimizing triggers like excessive caffeine and alcohol can significantly reduce anxiety levels and in turn reduce the frequency and intensity of tingling. Remember, anxiety tingling is a genuine physical symptom, a message from your body. It's not imaginary, and it's certainly not a sign of weakness. Understanding its mechanisms empowers you to respond effectively. The journey to managing anxiety and its physical manifestations is a personal one, but you don't have to navigate it alone. By seeking professional guidance, embracing coping strategies, and understanding your body's signals, you can move towards a place of greater calm and control. The future of anxiety management is focused on refining these approaches, increasing public awareness, and combating stigma, aiming for more effective and holistic care. Trust your instincts, listen to your body, and always prioritize seeking clear, evidence-informed guidance.